My name is Kit Wong. I'm an assistant professor at the University of Washington in medical oncology. And the take-home points from this year's ASCO updates on non-colorectal GI cancers are that nivolumab and chemotherapy is superior to chemotherapy alone in the first-line treatment of metastatic esophageal squamous cell carcinoma, especially for patients with high PD-L1 expression. Adjuvant nivolumab for a year after trimodality therapy improves disease-free survival for resectable esophageal and G-junction cancer, and it is now standard of care. Perioperative chemotherapy is not inferior to trimodality treatment in G-junction adenocarcinoma, so both are appropriate options for this patient population. And 5-FU nal-IRI is a second-line treatment option now for refractory biliary tract cancers after progression on first-line cisplatin gemcitabine. And finally, HII with FOLFOX did improve overall survival compared to sorafenib in advanced HCC with liver-dominant disease.